Welcome back to my diet and pain video series. Let's talk about knee pain. My first considerations with chronic or recurrent knee pain and injuries outside of the bones, muscles, and ligaments from a functional health perspective are intestinal health, adrenal stress, and gallbladder stress. Please keep in mind all of the info that we discussed about stress and how it impacts our ability to heal and stabilize joints. When it comes to the knees, one of the most common sources of issues is related to stress on the intestines. This can be related to food allergies or sensitivities, emotional stress, spicy food, not chewing your food well, dysbiosis or poor microbial health, or alcohol intake. Intestinal stress will typically have an impact on the muscles that move the leg forward and backward. Oftentimes, ACL injuries are related to chronic intestinal stress caused by the different stresses I mentioned before, along with patellar and anterior knee pain. Remember, joints are first protected by muscles that move the joint, then the ligaments that hold the bones together, and then lastly, the ability of the bones to withstand stress. When internal stress impacts the reaction time of our muscles, they decrease their ability to move and protect our joints, thereby increasing strain on ligaments. Over time, the increased strain on ligaments will leave the joint vulnerable to injury and prolong your recovery time. Chronic adrenal stress has many impacts on health. One of those is the impact on the medial stabilizing muscles of the knee. Chronic adrenal stress may have a general impact on ligament flexibility, which can increase the force of stress applied to ligaments with change in direction, change in speed, and stopping. In other words, many ligament injuries of the knee involve chronic adrenal stress. This includes skipping meals, overtraining, a suboptimal diet and sugary foods or processed foods, food allergies and sensitivities, low nutrition diets, emotional stress, suboptimal water intake, playing or exercising while sick, too little sleep, too much screen time, just to name a few common sources of chronic stress. Gallbladder stress may be unfamiliar to many of you. Your gallbladder, along with your liver, repackage fats for transport throughout your body. And we need fats for hormone production, making new cells, and for skin health. Some common stressors on the gallbladder are eating processed foods rich in trans fats, intake of other bad fats, foods cooked in oils at high temperatures, holding on to resentment and anger, poor dietary choices, obesity, and fluctuation in hormones like with menstruation or taking hormones in birth control. Knee pain related to gallbladder stress may present as posterior knee pain. There are other muscles, organ systems, and adaptations to stress that may impact the function of the knee muscles. However, the general categories I just reviewed will have a substantial impact on knee muscle function and pain. That will help build upon the general information that I've mentioned in my other videos. I created an online course called the DIY Health Assessment Course. It's a quick and simple way to organize your symptoms and lab results in a way that will help you understand what changes to make so you can recognize and reduce the stress you didn't know you had to begin the journey of decreasing pain and improving function. Also, if you want a quick reference source to help you make changes to your diet and lifestyle, check out my book, The Path to Health, a manual for proper care of the human body. Thanks for your time, and I hope this information helps broaden your perspective and helps get you on your path to health. I'm Dr. Richard L. Robles. Thank you.